What is the role of a care partner during autologous stem cell transplant?
So the care partner is an incredibly important part of myeloma care in general and the transplant procedure in particular. The amount of involvement of the care partner during the different phases of transplant can differ depending on if a person is having the transplant procedure in the hospital versus outside of the hospital. Outside of the hospital, I think that it is extremely important to have a care partner who is available and who is someone that the patient is very comfortable sharing all of the details about how they're feeling with. Some people are really very, very private, even with people that they've selected to be their care partner. And I think it's important that people understand that this is a situation where privacy remains important, but sometimes we have to talk about what's going on in the bathroom and what's going on in the toilet and being very open with each other. So on the outpatient side, I think having a care partner available all the time is really very, very important, particularly for driving, particularly to help make phone calls if someone's condition changes and they're not feeling well and they may not be able to clearly express what they've noticed about their symptoms. In the hospital, I think it's a little bit different. You have the luxury of having extremely well-trained nursing staff and other medical professionals who have their eyes on the patient in the hospital setting. That being said, some patients and their caregivers really feel more comfortable remaining in the hospital, and if that's what they want to do and if that fits with what the hospital's rules allow, I think that's absolutely fine to do. Many people, though, don't have the luxury of being able to take as much time off from work as they might want to. And the period of time when the patient is in the hospital can be a time when the care partner is still able to keep their job, continue to do some of their regular day-to-day stuff, and then also to help prepare for that patient returning to the home setting.
So the role of a caregiver during autologous stem cell transplantation is really someone who fulfills many roles. Whether a transplant is done inpatient or outpatient, transplant is a hard situation. People are intentionally given a high dose of chemotherapy, there are a lot of side effects, and they don't quite feel themselves. And so the caregiver is someone who can fill in the gaps. So if they need something as simple as groceries, that's something that person can do. If they need help taking care of their own medications, that management is something that they can hopefully do. And it's also just simply helpful to have an extra set of ears while listening to your care providers to catch those details that you may miss when you're not feeling quite yourself. The other important thing with a caregiver is that a lot of institutions will actually require one to be present with you. That's whether a transplant is done inpatient or outpatient. There's usually a caregiver agreement that's part of the process. And that is really just an insurance for the patient to make sure that they have needs that are important to cover that may not be easily covered by the providing team.
Are you required to have a caregiver if your transplant is as an outpatient?
You do, that is the key. If you don't have a caregiver, you have to be in the hospital. The key is to have a caregiver, and we give classes, education. So the caregiver has to be there, helping the patient through that, particularly the week of low count, checking temperature, make sure that the medications are given, around the clock, and then calling us if there is a problem, helping with grocery. The patient, we discourage the patient from going anywhere, right? So you go from the apartment to clinic, and so you need a caregiver for everything else, absolutely. So it's a big job, but we do a lot of education, classes for the caregiver.